Dr. Pittawa, are you seeing children in your practice?
Yes, absolutely, Helmut. We love children. Everybody has them. I have them. They have teeth. And it's definitely important to get children into the office at an early age to prevent problems, for one, and two, to teach them that it's not such a bad thing to go to the dentist. They're not so scared as they used to be. Mostly doesn't hurt at all. And the health benefits long-term from preventing dental disease and teaching the children how to take care of themselves is always worth it. And I'm always very proud of my parents who bring their children in on a regular basis and take good care of them. And we like kids. We have a big toy box for them. And we're not too mean.
Tell me, when should a mom, or a dad for that much, start bringing the kid in? At what age?
Well, Helmut, that's a good question. A lot of children don't come to see us till they're 2.5 because, well, that's when they have teeth. It's pretty hard to do any treatment on a child any younger than that. But the new recommendations are now to start screening children at around age 1. Just for the benefit of prevention and educating the parents and the children. And catching problems early is always worthwhile. An ounce of prevention is really true for dentistry. I know we say it a lot, but what can I say? It's true. So I had a little 7-year-old girl today, and I fixed 3 teeth. I gave her some anesthetic. She said she didn't even feel it. She left all cavity-free today, and so she's happy.
Great. So basically, educating the parents is really a big part, even before the children have the teeth. Is there any suggestions you can give to the moms of, while the children's are teething, or before or like right after, things which they could and should do with the children, or could or should not do with their children? Any suggestions you can give us there?
Well, sure, real quick, there's a few things I could tell you. I think breastfeeding is very good for children. It's good for the health of the mother and the formation of the dental arches. Whereas thumb sucking might not be so good. It tends to deform the dental arches. The other thing is never put your child to bed with a bottle that has anything in it other than maybe water. Their saliva flow decreases if you send them to bed with milk or juice or pop or anything else. The risk of decay goes way up. A lot more problems there. I used to see some very bad teeth because of that. The other thing that is a great benefit that not everybody knows about is a sugar called xylitol, which is a natural sugar that is not harmful to the teeth. In fact, it keeps the bacteria away from the mouth, and it's used to reduce tooth decay and the bacteria that cause tooth decay. So it's recommended that expectant or new mothers use xylitol gum to keep their mouths cleaner and less bacteria in them. And also small children who are old enough can have a xylitol candy, suckers, some can chew gum. Also reduce the incidence of ear infections, throat infections. It's really an easy thing to do. It's fun. I mean, you can have candy and it's good for your teeth. So I know it's not chocolate, but it's still pretty good.
Well, all right. Well, that's a good suggestion. What was that thing called again?
Xylitol. It's spelled with an X. Xylitol.
Is that something adults can and should take also, or is that for...
Absolutely. It's we keep plenty of it in the office. It's in our mouthwashes. We have gum, mints. It comes in a lot of forms. You can get it in your health food store, and it's a wonderful sweetener for candies that can be used to decrease the risk of decay up to 80% in some studies.
Wow. Is it a sweet?
That's a lot.
Is it a sweetener which can be used for baking and coffee and teas and stuff, or not?
Well, it can be substituted for sugar, but not in every instance. It doesn't behave the same as sugar for cooking. It's okay for some things, and I'm not too sure about that. I just know that it's useful in a lot of other dental applications and in the candies and treats that I keep suckers in the office. You can put xylitol in your coffee if you want to. It's also used in Europe a lot for the diabetics because it has a lower glycemic index. It's not as much sugar. It doesn't affect your body the same way as the other sugars.
Well, great. Well, anyway, kids probably would love that. So you're seeing children, and I think we got the idea they should go to a dentist around, a couple years old, and maybe the mom even before, to get educated of what could and should be done with the child, and not to let the child sleep with milk in a milk bottle and any that type of stuff, and maybe use this particular sugar, which I cannot pronounce the name, as a good thing. Wonderful. Thanks a lot, Dr. Pittawa.